All right, good morning, everyone. My name is Darren White. I'm the Warden of Dufferin County. I'm joined today by David Onley. And David Onley, as you know, renowned broadcaster in Ontario with City TV for quite a long time. Also, former Lieutenant Governor of the province of Ontario. Generally a man about town, knows a lot about all the different issues. And I'm glad you're joining us today. Thank you very much for your time.
Thank you, Warden White.
Yeah, let's get started, and we'll just ask you a couple of questions on accessibility issues. So during the pandemic, how do disabled people who normally deal on a daily basis with a non-accessible type world, how are they handling things that you know sort of during the pandemic as this rolls out?
There's a lot of suffering people out there. Individuals with disabilities are, by definition, are dependent to varying degrees on different kinds of social assistance. Some people, like myself, frankly, prior to my health issues last November, which I've mostly recovered from, lived an independent lifestyle, using long leg braces, using hand controls in my car, using a portable scooter that got into the back of the car. I could pretty much go where I wanted to go, do what I wanted to do, and do so independently. But mine was the exception, if you will. And if there was anything that the impact of being hospitalized on a sudden basis for what was fortunately a successful removal of a brain tumor last November 4th, in the weeks and months leading up to that, where I'd gone into a steady physical and mental decline because of the impact of the brain tumor, I had to be dependent and was dependent on daily assistance by PSWs and for bathing, for dressing, for it was really a tremendous change to my daily routine, and I became a very, very dependent person, and had lost that independence in very rapid order. For many people with disabilities in the province and Canada, but we're concentrating on the province and Dufferin County, their disability does not allow independence. And in fact, you can define the degree of disability on the basis of the degree of independence. The more independent you are, the less your disability is impacting you and impacting your family. The reality is what's happened with COVID, as we've seen the numbers climb and climb and climb until it became distressingly clear that a huge proportion of the persons with disabilities were in seniors' homes, and the huge proportion of the fatalities, 81%, amongst the very highest in the world, were individuals in seniors' homes, long-term care facilities, and virtually all of them were people with disabilities. The problem was at the very beginning, and this is what really exposed the issue early on. At the very beginning, when the first death occurred at the seniors' home in British Columbia on March 8th, and then more occurred at the same home in the days and weeks that followed, the immediate reaction that a lot of people had, and I must admit it was one of my first reactions, was, well, thank heavens it's just in a seniors' home, because those folks are old anyway and they probably have a compromised health situation to begin with. Pretty harsh, but that's what a lot of people were saying quietly, and that's what they were talking about, and we kind of collectively shrugged our shoulders. And because we shrugged our shoulders, we weren't aware that it was spreading the way it was spreading. Mm-hmm. We know this for a fact because in New Brunswick, the government there, because of the great thinking by one of their key cabinet ministers, who was an expert in the field, they shut down their seniors' homes in terms of visitations. They had PPE, they had isolation. They took all the measures that were necessary. And as of today, the grand total number of people in in New Brunswick who have died of COVID is 2.
Mhm.
As a percentage of the population, it's virtually insignificant in terms of, sadly, but the reality of life, other deaths, people dying of cancer, of heart attacks, of car crashes, of, just the range of mortality. We also know that in the Greater Toronto area, there's at least three, and I know there are more, but I personally know of three facilities who have had no cases, no deaths. And the reason was that they took initiatives early. They shut things down, not in February, but in January. They took very, very strict measures. And they met the needs of their patients who were people with disabilities. The flip side of this occurred in Mississauga at the Camilla Care Facility, where there was that terrible picture some 6 or 7 weeks ago of all these empty wheelchairs and walkers and other assistive devices sitting outside, and the picture represented all of the people in that facility who had died because of COVID. And that's when it really hit me, because I realized, okay, there's the connection. Every single one of those assistive devices belonged to a person with a disability. That's why they were in the seniors' home. And because measures were not taken, as they had been in New Brunswick, as they had been in, I can name three facilities or two facilities at least, in three in the Greater Toronto area. Shepherd Village on Shepherd in the east end of Toronto, the Wexford on Lawrence near Kennedy Road, a little bit further to the west, I should say, at Pharmacy, and downtown Toronto on Davisville at Mount Pleasant, the Claremont. Each of those institutions, 0 deaths, 0 cases, because they acted early. So what we know is, if proper steps were taken, the incidence of COVID was marginal, absolutely marginal, and probably at the very, very bottom of the list of ways that people die, just by virtue of being human. And so it just underscores to us how there are lessons here that we just have to learn, because we know there was a SARS outbreak 15 years ago, and now there's COVID, and it's part of the human condition. There will be a future incident of some sort, a virus that will attack humanity, and we just have to be prepared for it.
Exactly. I mean, in my role as the warden, I sit at the head of the virtual emergency operations table, and
Yeah.
I've watched as this has rolled out across the province and across the country, and I've watched as it has affected Dufferin County. We have a county-run seniors home in Shelburne, where unfortunately we lost 2 people. We had a few people infected, but not on a large scale.
Yeah.
But you're right, because our staff in many cases took actions before the government recommended things. They were already trying to figure out, what can we do here to stop this? How can we get a hold? And our staff were very good at doing that, and managed to keep our numbers down as low as possible. Conversely, just down the road at a privately run facility, there were, upwards of 20 deaths, and in a smaller home. And it's at one point
there is that's a very, very important point. I think the era of the privately run facilities has to either come to a complete end, or be strictly regulated under harsh penalties to management and to board members if violations occur. Because what you've just described you've described a success story in the public sector, and you've described a very disastrous story in the private sector, and that is repeated again and again and again and again across the province and across the country. And where they have taken the appropriate steps and have taken them early, the virus had virtually no impact other than the inconvenience of all the necessary steps. It also was because, in the case of the public facility you mentioned in Dufferin County, they were ready. They had the equipment. They had the PPE. They took action early. They got ahead of the curve. And as a result, as you said, 2 deaths. Well, there you go.
It's certainly shown the importance of being prepared, but it's highlighted other things as well, which I really hope are going to come out in the government's
Yes,
follow-up reports on things like wards versus private rooms. Our facility is
totally.
not. There are no ward rooms. There are no large settings where congregate things are happening, and that happens more so in the private homes. So it's
Definitely.
very clear the lines between those, and I'm really looking forward to some of those recommendations. And I hope as warden that even if some of those things aren't recommendations, that we will move forward proactively with them anyway, because
Yes,
it's the right thing to do.
absolutely. I mean,
Yeah.
in my family circle, my late parents in the early 70s uh, formed, along with a number of other people from our church, a group called the Brotherhood Foundation. And the Brotherhood Foundation created this seniors complex in Scarborough, the Wexford, the one on Lawrence at Pharmacy. And there, one of the fundamental things they talked about, and this is in the 70s, so this is not, it's a long time ago now, like 50 years ago, that so we would have, one person or a married couple per room, period. No ward rooms.
Mhm.
And the reason back then, in the very early 70s, 1971, 72, was they were concerned about flu and other communicable illnesses. And well, they were ahead of their time, but they made the right decision. And those that made the right decision, recognizing the issue, they're the ones that are the examples that we have to follow, or we're going to just have a repetition of this.
Yeah, it's unfortunate that due to the pandemic, we seem to be, in a general sense, in business now with stage 3 and whatnot in many
Yeah,
areas of Ontario. We're unfortunately having to add barriers now rather than take barriers away, which was sort of the
yeah.
direction before. So, what in general, what do you think can be done to sort of, to champion those rights of the disabled, where it comes to the addition of additional barriers now?
Right. Well, I just was on the phone a teleconference a few minutes ago with a former cabinet minister who was responsible for many aspects of accessibility, and just in the discussion, we came to the point that we agreed upon that the way we treat our elderly, our senior citizens, is indicative of the way we treat people with disabilities. That the two are very much related.
Hmm.
Um, the minority of senior people are able-bodied, independent, and live a fully functioning lifestyle, the same lifestyle that they lived in their 20s, their 30s, their 40s, their 50s, their 60s. There's a reason they call it the declining years. Well, what do they mean by that? Well, they mean the physical decline, the inability to do what you were able to do. That's why lift chairs have become very popular, because they help people get up from their chairs. So I think it's coming to a realization that people who, as you age, in all probability, your capacity to be independent is going to decline, and it's not a maybe. It is something that's going to happen. We don't like to think about that actively in our younger years because it means confronting mortality, and humans are notorious for an inability to confront our own mortality, even though we know it's real. So I'm just optimistic that dialogues like this one are just one of many going on where we're starting to come to grips with it for the first time. And we need to be looking at, some of the different models that exist in the other parts of the world. In Japan, for instance, in addition to the equivalent of what we have as a CPP, Canada Pension Plan, of course, they have a separate fund that people have bought into, agree to, does take extra tax dollars, no question about that, but it is specifically to provide quality housing for their aging population, for their elderly population. They have per capita one of the oldest countries in the world. They have, I'll just give you a couple of brief statistics. Their population is 126 million people versus Canada's 37 and a half. So we have over 8,000 fatalities of COVID. They have barely 900. They have 3.5 times our population, but they have 13% of our cases, of our fatalities. Why? There's a number of reasons. They're pretty straightforward too. One is that they don't shake hands and haven't done so since the 14th century. And you better know what your bowing procedure is, because if you do it the wrong way, apparently you can offend someone very, very badly. So you better know what your bowing is. Maybe we're getting to that point. Maybe elbow bumps and fist bumps are going to become much closer to the norm. So that's the first thing. The second thing is that we've started to wear masks. I wear when I go outside. Yesterday I had to go to the eye doctor for an overdue appointment, and had to wear a mask, had to wear gloves, had to bring my own pen to sign any documentation. Well, in Japan, they've been wearing masks and using hand sanitizer since the Fukushima nuclear disaster, and because of the Fukushima nuclear disaster. So their death rate is much, much lower than ours. And so you look at it from the practical standpoint of hand washing, sanitizer, face mask, don't shake hands, and they have this really quite progressive approach towards providing for your needs in your senior years to ensure that the quality that I know currently exists at the Wexford, that currently exists at the Claremont in downtown Toronto, another facility that got ahead of the curve early, 0 cases, 0 fatalities. Shepherd Lodge, over 900 residents, 0 cases, 0 fatalities, only 1 false positive test of an employee. So we know that it doesn't have to be as bad as it has been. We know that there's barely 30 deaths in all of Atlantic Canada. And if you had projected that forward across the country, across the entire Canadian population, if all jurisdictions had done what New Brunswick did, that our death toll in this country for the totality of COVID, this is proven mathematically, would be somewhere in the neighborhood of about 300 people. Mm-hmm. And that would be about half the death rate so far this year of people in car accidents in Canada. So we're not saying stop driving, because,
yeah, exactly. I had hoped and I spoke to my MPP about it, that we would just move the province to a mandatory mask order, even if it's only in the short term. And I understand the Premier's concern about enforcement and whatnot, but it doesn't have to be about enforcement. It should be about education more so than enforcement.
Yes,
and,
yes, very much.
I'm the same. I wear a mask out in public now. We were the first area in Ontario actually to have our medical officer of health declare a mask order. It's been in effect longer than anybody else's.
Yep.
And, I agree. It's one of those things we can do. Is it 100% effective? No. Is it a good step? Yes. Just like hand washing, just like things like your own pen. Some of those things I've already done because I work in construction when I'm not doing this, and I've had sanitizer in my vehicles for years, and it's just second nature to me now.
Yeah, so. And it's going to be interesting when they're talking what happens this winter, and there's I think some legitimate fears about a potential second wave, but what I'm wondering is I wonder if our incidence of flu and colds is going to be less this winter, because everyone will be sanitizing their hands, will be washing their hands, and will be wearing masks.
Right.
And probably won't be touching doors the same way. I've noticed a lot of doors now are propped open. Yes, it's summer, but I've noticed a lot of them doors are out and about are left open. And I do wonder, and I think that this is a golden opportunity for all companies to be thinking very seriously about installing automatic doors,
Right.
infrared doors, sliding doors. I mean, had to go down to Sunnybrook for a checkup about a month ago. Well, sliding doors. Why? Well, you don't have to touch the door. And when you think back to, the number of door handles that we've touched in our lifetimes, touched by hundreds and thousands of other people's, and you have no idea what their conditions were. It's amazing that we haven't had far, far more outbreaks of who knows what.
You're right.
So,
I'm one of those guys who, I don't know, I wouldn't call myself a germaphobe, but in public, a
yeah,
lot of times I'm the
yeah,
one finger on the door guy. I don't
yeah,
like to,
yeah,
and it's just, it's become second nature to me now, and that's
yes.
just the way it is. But you're right. It'll be interesting to see those data and statistics on
Mm,
flu and cold and other diseases as we move forward with masks and protection. And it's also important that I think we're starting to grasp the importance of those folks that are in essential fields. Even somebody
yes.
as what would have been considered a basic job of cashier at a grocery store now has become so important to society. And who would have thought 6 months ago? And
And
PSWs as well.
well, exactly. I'm glad you mentioned them because, I think that PSWs have become in a real extent, some of the unsung heroes in this
Mhm.
situation, and that our perspective towards PSWs has got to make a 180-degree turn if it hasn't already, in that the value of them to the system is now seen to be absolutely profound. And yet, up until now, until this hit, it was pretty much a jurisdiction of people who were new to Canada who, weren't able to land a job that provided for their families, and, took a quick course education on how to be a PSW, and that's what they're doing. And, when I was prior to my surgery and afterwards, in terms of my recovery, I had 2 or 3 different PSWs and finally settled on one. But in each instance, they were all new to Canada, was not what they wanted to do. They were looking for career advancement, but this is what they were doing to support their family. And well, lots of people have to do that. My grandfather did when he immigrated to Canada in the early part of the 20th century, took what he could
Mhm.
get to provide for family. So it's not uncommon, but this is our opportunity to recognize the crucial role that PSWs play, and we have to look at them differently as crucial parts of the medical system itself, its entirety. If you want to do in terms of education levels and hierarchy, yeah, okay, we'll start at, the literal brain surgeon that took a orange-sized tumor out of my right frontal lobe and did so successfully. Okay, we put him near the top, or at the top, along with other surgeons and people that do remarkable things that you nor I could never do in 3 lifetimes. But and work our way down the, if you will, education and technology list, to other qualified doctors, phenomenal general physicians, family doctors. And it's not a matter of priority on the basis of better than. It's just that's the way we look at them. But having said that, up until now, the PSWs have been pretty much at the bottom,
Mhm.
pretty much.
Yeah, and they carry a lot of the water, and they have
Sure
through
do.
this. And I think you're right. Our perception of what they do and what their importance in that scale
Yeah,
certainly does need to be changed.
it
So
does.
yeah, let's talk about government for a second. You were a part as Lieutenant
Yeah.
Governor of Ontario, and I met you
Yes.
down at the Queen's Park one time a long time ago.
Yes. Yes.
And I'm a warden and a local mayor. So, what's been the government response to the issues of surrounding the pandemic and disability as it relates to the pandemic and whatnot, from your perspective?
Well, now that I'm no longer lieutenant governor and I'm apolitical, I've certainly in that office, that was my constitutional obligation to be apolitical. So it was not optional, and
Mm-hmm.
I was very, very conscious of that, and came to realize and recognize that there were, you know, many, many people on all sides of the political spectrum, all 3 parties that had were and are diligent, hardworking people seeking to serve the public and meet the needs of their constituents. And I just take that as a fundamental given. Each government has different agendas. And, you know, the Ford government has come in and to a very real extent as a backlash to perceptions related to the McGuinty government and the Wynne government. And it is a reality of Canadian politics that governments just have a certain lifespan. And then what happens is people get tired and they throw them out and they put a new group in and they give that new group a chance. Sometimes it's a long stretch. The Tories were in power for 42 years at one stretch in this province. Sometimes it's a short stretch, as it was for the Bob Rae government. 5 years, thanks so much, see ya. But somewhere in between is what we typically have. And I think it's too early at this point to know what the public's reaction is going to be in terms of the functioning of this government as it relates to COVID immediately. That's the immediate issue. But the related issue has to do clearly with persons with disabilities. That's what my review of the Accessibility Act, the AODA, was more than almost a year and a half ago now. And there's still a long way to go in terms of accessibility. Some of my recommendations have been accepted by the government. Others have not been acted upon. I give them a certain degree, a significant degree of allowance because as soon as COVID hit, then the government's attention had to be really directed at that, and its focus had to be on that. And virtually every other aspect of our society kind of slid to the sidelines, quite frankly, and I think that's just the nature of things. Having said that, I think what has happened is that COVID and the issues and the suffering, the real suffering that a lot of disabled people have gone through and are going through, people that write to me, that contact me, and sometimes in complete despair over what to do next because of their personal situation or a family situation. What it has shown me is that this crisis has exposed some of the fault lines in the healthcare delivery system and fault lines insofar as the way persons with disabilities are treated. The two overlap. Ageism, that is discrimination against elderly people, and ableism, that is discrimination against people with disabilities, is very real. It's subtle. It's very subtle, but it exists. And we know that it exists because those with disabilities and the elderly are at the bottom of the totem pole, if I may use that analogy, when it comes to government assistance and government programs. We know that to be a factual matter. It is a matter of fact to say that. It is not opinion, because the death toll of people in this province because of COVID is 81%, and that's people, all of them are persons with disabilities in the senior citizens' homes, in the long-term care facilities. And it's just 19%, and every death is a tragedy. A gentleman in our church died, of COVID. My son got married on June 7th in a small backyard ceremony, and one of the bridesmaids' father, who is just 50 and otherwise healthy, died of COVID. So that does happen and has happened. And we see most recently, just in the last number of days, concerns about the incidents in younger adults. But what we do know is that 19% of all of the fatalities related to COVID are people who do not live in seniors' homes. So that's a very significant number, very, very significant, because it underscores that the people that have suffered the most are those who are the least able-bodied and those who are seniors. And that's just a fact. So whatever we're going to do to get our way out of this, and whatever we're going to do to make sure that this never happens again, certainly not in my lifetime, and definitely not in my kids' lifetime and my grandchildren's lifetime,
Mhm.
is that we just have to look and analyze what it is about being elderly and being disabled that viruses become killers.
Mhm.
And once we address that, then we can decide what action we're going to take as a society. One thing's for sure is that our taxes are going to go up, but you know what? They're going to go up anyway because of all the assistance programs. So we may as well double down and get it fixed and make that our great contribution to the next generation, quite frankly. So there we are.
I agree. I agree, 100%. So last point we'll touch on. Um,
Yep.
we have accessibility committee at the county level here. We've
Mm-hmm.
merged it with some
Yep.
of our larger communities in the county, or specifically Orangeville.
Yep.
We have some great local advocates. And from someone like yourself, who's a larger advocate in that
Yep.
sphere, how can communities like mine help this issue? How can we push the ball down the field and get more things done? Your advice from an advocate.
That's a really good question. That's what someone always says when they're not quite exactly sure what the answer is and they stall for time. Um, it is a matter, I firmly believe, of just constantly, as tiring as it gets, constantly advocating at all three levels of government. So if you're a citizen, you just have to keep advocating. If you're a member of the local council, if you're a member MVP at Queen's Park, if you're a federal member, you just have to keep advocating. I think, having said that, though, that one of the realities is that we really have to look at what we're trying to do insofar as persons with disabilities are concerned. And that is very much dependent on what age we're talking about. For young people yet to go through the educational system, a range of assistance has to be provided. The reason that I became a successful television broadcaster for 22 years and thus had the opportunity of becoming lieutenant governor was because of an existing program in the late 60s in the province of Ontario called the Vocational Rehab Program. And that program provided the tuition for me to go to university and provided a small stipend during the summer months because the program of the day back in the 60s, so would have been a conservative government, it would have been the government of John Robarts, rest his soul, instituted this program that provided income for me, financial assistance for my family, and we were okay. My dad was a lawyer at the city of North York. Prior to that, at the city of then the borough of Scarborough, but that wasn't the concern. The recognition was, if you need help to get through, we're going to provide it for you. And because of that, I received a fine education at the University of Toronto, Scarborough campus, then called Scarborough College. And because of that, I was able to move on through my career. I had the education to get to the next level, the next step. The key really is, at the youngest level, education. Then, along the way, financial assistance was provided for the inclusion of hand controls into my car so that I became independent. I could drive where I needed to go. A government benefit was introduced as a tax deduction, recognizing the costs of a person functioning in society with a disability. There are more costs involved than the able-bodied population. And so on it goes. All of those programs that were instituted in the 60s, this is a long time ago now, or more than half a century ago, provided for people like myself and others with the assistance that was needed to give us the opportunity to be functioning independent members of our society. your question now prompts me to go back and do some calculations. I don't know what the exact numbers are, but I can tell you I made a very good income at City TV. I had a comfortable income as Lieutenant Governor, even though there was a cut in pay, quite frankly. I certainly didn't complain about it. There were some other benefits that came along. But I can tell you that the government, in return, has gotten more out of me in terms of tax dollars, which I don't mind paying. They've gotten way more out of me than they ever put in the first place. And over a lifetime of employment, they've got it back many, many times over. So those are some of the mechanisms that are required. And I mention it because we have over 800,000 people on ODSP right now in the province of Ontario, Ontario Disability Support Payments. And I've been tweeting about this recently and Facebooking about this recently, retweeting comments by people, because unfortunately, the structure is, and it exists elsewhere, but it exists right now in Ontario. Ontario Disability Support Payment is nothing more than legislated poverty. People who are on ODSP live in poverty. There is not an aggressive enough mechanism to get them out of poverty. And there's only one way to get out of poverty, and that is to have a job. The mechanism works against ODSP recipients searching for employment and getting employment because of the dreaded and feared clawback, even to the extent where ODSP recipients who were eligible for CERB assistance from the federal government, the CERB, had amounts clawed back. And one's mind just kind of boggles at that point, that in the midst of a crisis, in the midst of a circumstance where the person is living in poverty and has additional expenses because the other services are not available, because of the societal shutdown of COVID, that they're actually having money deducted from their ODSP benefits. It's head shaking. It really is head shaking. It should not be happening. There needs to be, as a return benefit coming out of our society of COVID, if anything good can come out of this, there has to be an aggressive full court press program to get as many people on ODSP off ODSP because they're gainfully employed. We have to work towards getting as many ODSP recipients into the workplace as we possibly can. When I saw a document a couple weeks ago put out by the Royal Bank talking about how COVID was impacting immigration, and because of that, our immigration numbers were going to drop, and because of that, there was going to be a shortfall in hiring, and that companies were going to be really caught by not having enough people to hire. I saw the headline, this was in the Toronto Star, and the words were to the effect that there was like a blind spot insofar as hiring. And the notion in the article was that the blind spot was we hadn't realized that the people with disabilities, or that the immigrants were not coming into the country because of COVID, and therefore we're going to have a job hiring issue. I thought from the title that they were finally talking about hiring people who are blind. And as I started to read the article, I went, well, not only are they not making any reference to people who are blind, who have some of the highest unemployment of all disabilities, but they weren't talking about persons with disabilities at all. And, you know, the highest growing percentage or age group getting on ODSP are people in their 20s, which is a complete tragedy, because once you're on, it's very difficult to get off. And we're looking at it, therefore, a lifetime of government assistance. And that single program now has to be addressed in a major, major way. And if it means that employers are offered significant financial advantages to hiring people who are formerly on ODSP, then so be it. Get the process rolling, get these 20-something people into the taxpayer bracket, and you're going to get 35, 40, or 50 years of tax dollars out of them. You'll make it back, guaranteed. The mathematics are clear. That's really what needs to be done.
Yeah, I agree. And we talk about those programs like Ontario Works and
Yep,
ODSP a lot at our Community Services Committee, with
yep,
the understanding of they're just not enough
no,
to, you're right, it is legislated poverty.
yeah,
It's really what it is. And as I've rolled out through this pandemic, being a person in charge, I've
yep,
gone through the disbelief, the
yep,
anger, the fear, all of
yeah,
those stages. And I try to be positive right now. And I believe that, and I really do believe that people in positions of influence and power, like myself, like
yep,
yourself, like the provincial, federal governments, community leaders, we have a limited time window,
yep,
thanks to COVID, where we can really make an impact and a change onto the
yes,
way our society operates and functions.
I
Uh,
agree.
I don't think it's a long-term window, and
No,
I think quick action. If we take it, if we seize the opportunity, we can make some really positive changes in the way things operate. So let's leave it on that
okay, thank you.
positive note.
Absolutely,
David, thank you very much for chatting with me. I've always
thank
been
you,
a big fan of your days at City TV,
thank you.
and your work as Lieutenant Governor as well. And I want to really sincerely thank you for taking the time to talk to me today and to
Very
talk to the
welcome.
residents of Dufferin County.
Thank you. It's a
Very
privilege.
informative chat. Very informative chat. And
Thank you very.
hopefully we can move forward. We can keep making society
Absolutely,
better for everybody.
absolutely.
Okay. Well, you have a great day, and thank you very much again for joining us.
Thank you.